Wearing red or the lapel pin, they're wonderful ways to show your support for women and heart disease. But of course, nothing speaks louder than words, and nothing is more powerful than real women telling their stories. Health Corner correspondent Sarah Welch has more.
Joan, when it comes to women and heart disease, Debbie Ann Schneider has a powerful story to tell. At Dance Connection in Queens, New York, this Zumba class is as much about staying in shape as it is an exercise in how life changes in an instant.
When it comes to telling my story, they look at me and they say, this is somebody that could happen to me.
After a workout 4 years ago, Debbie Ann Schneider ended up in the emergency room. She remembers feeling sick, her heart racing, and she couldn't take a full breath.
My dog jumped up on the bed. He put his head on my chest. And I was like, you know, all these things are starting to add up. I can't even believe it that I could be having a heart attack.
At 42 and in good health, a heart attack was the last thing on Debbie Ann's mind, except to see a program about the red dress fashion show and heard the story of Wanda Swego, who was unaware of the warning signs.
That got me upset because that was lingering in the back of my mind. It was when into where there could really be something wrong.
Debbie Ann, like many women, didn't have the textbook symptoms but drove to the hospital anyway. Tests revealed the news.
And when they came back, the doctor was actually looked like all the blood ran out of his face. He was white as a ghost, and he said, "You had a heart attack."
What happened to Debbie is living proof why events like the Red Dress Fashion Show and raising awareness about heart disease is so important and effective.
It's about picking up the telephone, making a phone call to the doctor's office to get a checkup. It's about helping your friend get to the doctor if she doesn't have transportation.
Dr. Goldberg's office, Corey speaking. How may I help you?
Dr. Nisa Goldberg is a New York City cardiologist and the author of The Complete Guide to Women's Health.
I think when we talk about real women in heart disease, it's about getting to the women that you know best and tell them, yeah, you're really smart. You know, heart disease is the leading killer of women. But now you have to take care of yourself. It's not going to be some other woman. It could be you. You know, there aren't really any cutting-edge scientific studies on women and heart disease this year. But we don't need them because there are plenty of women out there not doing the things that they need to do where we have hard science that if they started an exercise program or changed the way they were eating, they could reduce their risk for having a heart attack or a stroke.
We'll see you tomorrow. Have a great afternoon.
Working for Dr. Goldberg has inspired Corey to take better care of herself. She's a healthy 20-something but knows the need to start early by knowing her numbers when it comes to blood pressure and cholesterol and reducing stress.
You're really at goal.
Good.
She recently lost 30 pounds.
I had one woman tell me that really inspired her, and she actually came in recently and she lost 40 pounds. And she's been going to the gym like crazy. And she said that when I told her that I lost that amount of weight, that it was really inspirational to her, which made me feel good and made her healthier, which is the most important thing.
Debbie Ann, now 46, leads this class to inspire real women like her sister Linda.
I exercise. I see my doctor regularly, which I hadn't before, and I watch out for the symptoms.
Wanda Swego made it real for Debbie Ann Schneider, a woman she's never even met but believes saved her life.
Thank God I saw that show, and thank God for Wanda for sharing her story.
Debbie Ann has spoken with Wanda by phone, but hopes to one day thank her face-to-face for her help in spreading the message about women and heart disease. For Health Corner, I'm Sarah Welch.